Well, thank you all for joining me today, and I hope you find this discussion helpful. It's one of those things that I can talk about for hours, and so I'm going to be moving quickly through the slides because I do want to get to our discussion. The first thing I always like to do is just disclose that I have no conflicts from a CME standpoint to disclose. I am employed full-time by the AAFP, so I'm talking with you today from cloudy, soon to be rainy Kansas City, where it's been hot and humid, and summer has arrived early here. But I'm employed full-time by the AAFP. As Kate said, I practiced in Indiana for many years, but I still have an Indiana license, but I haven't clinically seen patients now for a little over 5 years. Wanted just to touch base on some learning objectives for this session. First of all, at the end of the session, I hope that you all know some resources available through the AAFP and other sources that'll be useful to you in addressing family physician well-being and professional satisfaction. I want you to be able to utilize the family physician ecosystem framework when you develop your plan to improve your personal well-being. And I also want you to be stimulated to develop a plan to improve family physician well-being, because it does take all of us working on this together. And one of the questions that comes up, why has the American Academy made this a priority? And so I do think it's important to acknowledge that this is one of our top 4 priorities as determined by our board of directors in strategic planning sessions in 2016. So it's been just about 2 years ago that the Academy's board of directors decided this was one of our top 4 priorities. And so just so you're aware, our top priorities are payment reform. We believe that primary care is underpaid, and that that to have a healthy and improved healthcare system, that primary care needs to be paid significantly better. Practice transformation. We believe that our members need some assistance in moving away from more traditional practice towards the payment models that we see on the horizon. We want to be seen as a leader and take a leadership role in striving for health equity and addressing social determinants of health. And then improving family physician well-being is our other top 4 priority. And the specific strategy statement that our board adopted is that the AAFP will assist members in achieving well-being in order to enjoy a sustained career in family medicine. I think the key words there are well-being, enjoy, because we really look for family physicians to have a much higher level of satisfaction with what they're doing, and sustained, because as you all know, the primary care workforce in the United States is less than it needs to be from a volume standpoint. We need more primary care physicians. We need more family physicians. And so, one of the things that we worry about is that burnout and dissatisfaction are causes of people leaving practice, mid and sometimes even early career. And so we really do look for a sustained career in family medicine. And I'm pleased to serve as the executive sponsor for this strategy for the Academy. And so, this is what we hear from our members is, don't try to fix me, fix the system. I'm not broken, it's this crazy system that I'm in. This isn't what I signed up to do. I went into medicine to take care of patients, and I feel like I spend my time on administrative tasks rather than really doing things that benefit my patients. And at the same time, we hear, help me, because I'm drowning in this crazy system. So it's not one or the other. It's a broken system, but that broken system is having ill effects on family physicians. And so we're trying to fix the system, and we're trying to help the individuals who are trying to thrive in the midst of that crazy system. And just as a point of reminder, when we talk about burnout, the classic description of burnout that's been in place for over 30 years, it was described by Dr. Christina Maslach, and you may recognize that name. The Maslach Burnout Inventory is the longest standing tool out there to evaluate for symptoms of burnout. And burnout is classically described then as this triad of lack of enthusiasm or energy for work, so feeling that just don't have the energy to do the work I want to do, a feeling of cynicism or depersonalization or a lack of empathy. And we hear this from physicians who say, you know, when I first started to take care of patients, I felt this real connection, and now I don't necessarily feel that same level of connection to my patients, that same level of caring that I had before. And then the third part is the one I think that's really distressing, is that physicians sometimes feel that despite all of the work they've put into their career, the hard work of getting into medical school and of making it through medical school and then training after medical school, you know, devoting their lives to taking care of patients, that they don't feel that sense of accomplishment, like they're really making the difference that they thought they'd be able to do. So this is just, again, as a matter of reminder, this is what we're talking about when we talk about burnout. And the AMA has done a lot of work on this and have really developed some nice resources. And you know, the AMA talks about the drivers of burnout being high workloads, workload inefficiencies, increased time spent in documentation, this loss of feeling of meaningfulness in work. And then these last two bullet points that I think are really important to be aware of. And the first there is the social isolation, the feeling of being socially isolated at work. And you know, this comes up when we do workshops and we get into small groups and talk. And one of the things that I hear very frequently is, I thought I was the only one that felt this way, or I don't have anyone that I can share my feelings of frustration with. And so this is a really important concept of social isolation. And then the last one, there is this cultural shift that we all are feeling about healthcare, that healthcare has drifted away from being patient-centered and really focusing on the values of putting patients first and doing the right thing for patients and improving health and healthcare, and a shift to corporate values of profit and other things that seem to be really highly emphasized within the corporate culture. And this is causing, you know, a significant degree of moral distress for physicians who feel like their personal values and the reasons they went into medicine are not meshing with the values they're seeing now in this corporatization of healthcare. And burnout has repercussions at both the personal and professional level, and it's important to recognize that. And you know, this manifests itself at the practice level because of the effect that it can have on the quality of care and the safety of patient care, as well as the experience for the patient can be negatively affected. It can decrease productivity and result in physician turnover. And we know that physician and clinician burnout is costing the healthcare system in the United States billions of dollars a year because of these ill effects. But beyond the professional effects, there are personal effects as well. Burnout is not a medical diagnosis. It's not a, you know, it's not a medical condition. It's a work-related phenomenon. But it certainly, in extreme forms, can manifest with significant personal issues, including the development of depression. We know that burnout is a risk factor for depression, and unfortunately, we are aware that there's a high rate of suicide amongst physicians. So it's important to think of this, I think, from the effects that it has on the populations that we take care of, the effect that it has on the economic aspects of healthcare, but then also on the personal costs that this really results in for those physicians who experience burnout. And so here's a formula for distress that we've sort of developed over the last few years from discussions with family physicians all around the country, and that is that EMR times RVU equals I am sad. And you know, on a broad sense, what the EMR represents is all of this administrative burden that doesn't necessarily increase the quality of care or the experience. It doesn't generate value for either the patient or the physician. And then RVUs represent that increased workload and that hamster wheel that we hear people talk about of, all my incentives are to see more patients. I want to take great care of patients. I'm told I've got to provide a high quality experience for my patients, but but I'm being judged on how many patients I see and paid by RVUs. And so this is, again, this formula for moral distress. And we know that, unfortunately, family medicine is one of the higher affected specialties by burnout. This is data from a Medscape survey that was published in January of this year, 2018, and family medicine continues to be in the top 3 by specialty. There's a persistent gender gap related to burnout, and we know that there's a 10% higher risk for women in medicine for burnout, and that's across all specialties. But this is very consistent year to year in the Medscape surveys that they've done, that it's been 3 years in a row now that there's been a 10% higher rate of burnout amongst women in medicine. And then happiness outside of work, half of family physicians and across all specialties, about half of physicians feel extremely or very happy outside of work. So again, you can have this feeling of burnout at work, but still happy outside of work. But then here's one I think that's really important to look at, and that is, which physicians are happiest at work. And again, unfortunately, family medicine is right down there at the bottom. 22% of family physicians in the Medscape survey this year said they felt extremely or very happy at work. And so the concern is that, you may not be burned out. So 47% in this survey had symptoms of burnout, but only 22% said they were happy at work. So there's this big gap in between of family physicians who aren't burned out, but they're not happy either. And so our concern is we can work on decreasing the burnout rate. Let's say we decrease the burnout rate to 20%. But if we don't increase the happy at work, that basically leaves this big gap in the middle of folks, again, who aren't burned out, but they're not happy either. And so we believe that it's important to think of well-being not as just the lack of burnout, and that the lack of burnout doesn't mean happiness. And so we believe it's important to focus on improving well-being and professional satisfaction, not simply decreasing burnout. And the way we've approached this is through a 5-level framework of the family physician ecosystem. And I'll briefly touch on these, but at the big level, it's the health system regulations and requirements, and those are the things that at the AFP we are advocating on a daily basis in DC to try and decrease this administrative burden, and I'll touch on that a little bit more. Then at the organization level, we know the majority of physicians report that family physicians of our members report that they're employed by an organization, and that has an effect on their well-being and professional satisfaction. We believe organizations need to make a higher priority for improving physician well-being, and they need to invest in the things that will do that. Then there's the practice level. That's where you see your patients every day. It's the teams that you work on. And sometimes there are frustrations there of inefficiencies and opportunities to improve the experience of the day-to-day practice level. And then next is at the individual level. It's those individual habits, beliefs, behaviors that affect your health and well-being. And we certainly know that there's evidence that there are certain habits and behaviors that can increase your sense of well-being. And then the harder one to really describe is the physician culture. And it's that culture that we were all raised in through medical school of self-sacrifice is noble. And in fact, that self-sacrifice is probably more highly valued than self-care. And that if you are focused on taking care of yourself, that you're somehow selfish. And that makes you a weaker doctor and leads to a real sense of shame and guilt when you are focused on trying to take care of yourself. And so these are the 5 levels of the family physician ecosystem that we are trying to address with the resources and activities that we've put into place. And you may have seen that the Academy has really made reducing administrative burden a significant focal point this year. Mike Munger is our current president. He's talked about this extensively, as well as our board chair, John Meggs, has highlighted this in many of his communications. And we've spent a significant amount of time in DC trying to help folks understand the unintended consequences of the administrative burdens that have been put in place over the last 30 years. I really believe that in my career, that having practiced before the implementation of E&M coding guidelines in the 1990s, that that was a significant watershed moment in the increase in documentation burden. And so we spent a significant amount of time in DC advocating to decrease the requirements for prior approvals, to simplify quality reporting, to ease the documentation requirements, and CMS right now is actually open for comments on how to improve E&M coding, and so we've made extensive suggestions on how to do that much better. Advocating for EHR functionality, and the EHR is basically designed to document for billing purposes, not for clinical purposes, and so we are emphasizing the importance of that, as well as emphasizing the importance in investment in primary care and primary care services, and focusing on population care and outcomes rather than the quantity of patients that you can see. And so two high-level metrics that the AAFP is following. These are our board metrics. This is what we report to our board each year in July. And so this is from a survey that we did in June of 2017. And that was the question, if you had your career to do over, would you choose to be a family physician? And only 55% indicated that they would choose to be a family physician again. It's interesting when we looked at it by demographics. The demographic that stood out with the highest reported choice of being a family physician again are those that have been in practice 22 years and longer. So that's just an interesting thing to be aware of. So we've set a short-term goal of seeing an improvement by 5% between 2017 to 2018, and we have just completed gathering that survey data, and we'll be learning those results in the next few weeks. But what you'll see there is that there's a big chunk, 23%, who don't know if they would choose to be family docs again. And I think that correlates well with that gap that we saw on the not happy in practice but not burned out. The other metric that we're looking at is how's the AAFP doing as far as providing resources for members. And what you'll see there is that 24% in the survey last year said they strongly agree or somewhat agree with the fact that the AAFP provides effective resources to assist with their well-being. And again, the big areas there, neutral 31% and don't know at 31%. And so our short-term goal when we repeat this this year is to see that jump almost double up to 40%. We want to make sure that our members value the resources that we're providing. And so here are the resources that are either currently available or in development. And again, this really just rolled out last year. The survey was in June, and we really kicked this off at FMX in September of last year. And the first big part of the rollout was our Physician HealthFirst portal at aafp.org. And that is something that only our members have access to parts of that portal. Anyone can look at much of that, but one of the things that we've made specific for members is access to the Maslow Burnout Inventory. And again, that launched in 2017. And then in April of this year, through the Physician HealthFirst portal, we released our well-being planning tool. And I'll go through that in a bit more detail in just a minute. But that's been built around the 5 levels of the ecosystem that we just reviewed. And we've been fortunate that much of this has been funded through the AAFP's foundation that has funded the development of this content and making these things available for our members. I'm going to touch on our conferences. We had our first conference this spring, and we plan to have one again next year. We're in the process of developing a state chapter workshop series that state chapters would be able to access. We've had an ongoing series of articles in our FPM, the Family Practice Management Journal. We've had tracks at FMX the last couple of years, and we continue to expand that. We're in the process of developing a practice improvement activity that will qualify for maintenance of certification credit through the ABFM, and that is in association with the ABFM, and they've generously funded development of that activity so that you would get both CME credit as well as MOC credit as a practice improvement activity. and we plan to launch that in 2019. And then we've been a significant partner, a co-sponsor of the National Academy of Medicine's Action Collaborative on Clinician Wellbeing and Resiliency that kicked off in 2017. So we're in the second of 4 years, and I'll talk a bit more about that. And so, so here's our portal, the Physician HealthFirst portal, and you can find that at aafp.org/mywellbeing. And what you'll see is there's several resources. If you click on the Find Resources, there's many articles and interviews that we've recorded over the last year that are available there. You can go in and do the Maslow Burnout Inventory and get a personalized report back based on your answers to the questions in the inventory. You can then go to the planner here, and I'll walk through a bit of that as well. And then there's information there about the conference. And this is just a screenshot, but you can scroll down and you'll see multiple resources. And again, this is organized around the 5 levels of the family physician ecosystem. So in April of this year, we did kick off our WellBeing Planner, and the idea there is that there are so many resources available on our website, and the planner lets you organize those resources, basically save your favorites, so that you can, if you find an article that you like and don't have time to look at it right then or explore more about it, you can save that into a personalized resource list that you can go back to over time. And it gives you an opportunity to set goals and make commitments to improving both your well-being as well as the well-being of others that you work with or others in our specialty. And then it gives you an opportunity to track and measure your progress. So here's what it looks like when you go to the WellBeing Planner. And again, it's this 4-step process of committing, reflecting through what you learn off of the MBI, developing your plan, and then over time coming back to track and refine that. And so this is an example of, there are many sort of pre-developed goals that you can go through and choose which ones you want to emphasize. Or if there's something that you want to do that's not on that, you can create your own goals. And so it's been interesting to see as our members utilize the planner, what they're prioritizing as their goals and what goals they've created. And so just a little bit about the utilization of these resources to this point. We've had over 3,000 of our members now that have gone online since last September and completed the MBI and gotten their MBI report. The planner, again, was just launched in April, and as of sort of the middle of May, I think was the last that I saw new numbers on that. We'd had 488 members who had gone in and developed a plan through the planner. In May, we had over 15,000 page views on the Physician HealthFirst portal, and then these are just some examples of the most popular resources that are accessed related to well-being. So that just gives you a sense of the utilization of those resources. I wanted to talk a bit about our first AAFP Family Physician Health and Wellbeing Conference that was held in April this year in Naples, Florida. And it was 3.5 days, and we had 458 folks attend. When we first started planning this a couple of years ago, we weren't sure if anybody would show up. And as far as I know, we're the only specialty that has developed a conference like this specific to our specialty. And it was just incredibly well received. It was very gratifying to get feedback from our attendees. 98% of those that completed the survey that attended either ranked it excellent or above average. Only 2% ranked it as average, and nobody ranked it as below average. And 71% of attendees ranked it as excellent. So we were really quite pleased with the feedback that we got. And in fact, in a survey that we did afterwards, 50% of attendees said they would plan to attend every year. And so that was, again, that's says a lot for what folks found valuable at that conference. And it was interesting, 43% of our members are women, and 70% of those that attended the conference were women. And so it really just highlights, I think, again, the appetite that folks have for seeking some solutions to help themselves with their well-being, but also to try and improve the well-being of family physicians as a whole. And so, again, really pleased with how that turned out and the feedback that we've gotten from those that attended. And here was the construct that we used is, again, we're not trying to just help people keep from being burned out and just surviving or feeling fine. We're really trying to help folks optimize their well-being and a sense of really thriving and feeling that they're growing as family physicians. And so this is the approach that we take. And Mark Greenewald is our conference chairman and really did a stellar job of helping direct the curriculum and the activities at the 3.5 days in the conference to really focus on that. And so I'm excited to let you know that we have scheduled our second annual Family Physician Health and Wellbeing Conference. That'll be next June, and that'll be in Phoenix, Arizona at the Sheridan Grand at Wild Horse Pass. And I've been at other conferences there, and it's a wonderful setting. It's going to be hot in Phoenix in June, but it was interesting. We were in Florida in April. Many of the folks there are from the Midwest, and we had people there from Wisconsin telling us they had just had 20 inches of snow in the first week of April. And so we encouraged people, we knew they were here for their health and well-being. And so, skip out on sessions, go to the beach, do things. But our sessions were all 3.5 days were packed. And so we know that though it's going to be really hot in Phoenix, the sessions will be indoors and it'll be nice and cool indoors. Some more resources that I really want to point out. This is the most recent article in FPM that we published. And this is highlighting team-based care model in Colorado, and Corey Lyon was the lead author on this. I just think this is something that we need to be aware of, that there are good models out there for team documentation that really have improved physician satisfaction and decreased burnout. In their study, it decreased their physician burnout from 56% to 28% in the group that utilized this team documentation model. And what we've seen and heard from members and in discussions is that, the team documentation or use of medical scribes, there's different versions of this, but in general it increases patient satisfaction because they get more eye contact with their physician. It increases physician satisfaction because they're able to focus on the clinical aspects. It has been shown to decrease burnout. It's a cost neutral at about 2 additional patients per half day, and it significantly decreases the work after clinic by about 1 to 2 hours a day on average. And so a really good model to consider. And so our practice advancement team has been developing a series of modules or tips that transform your practice. The modules that are available right now are on quality improvement in your practice and empanelment for your practice. But the next one that's going to come out is on team documentation. We think that's going to be a terrific resource to help folks find a way to, to decrease the amount of time on the fingers on the keyboard and eyes on the screen, and more focus on patients and letting the team do the documentation aspects of things. For some of our members, finding an alternative practice model is really what they've found to be most helpful. About 3% of our members are now in a DPC model or direct primary care model. But we know that up to 40% of our members state they have looked into that model, considering that model, thinking about that. And so, we joke that when you go to a meeting, you can tell which family docs are in a DPC model because they're the ones that are smiling. And we hear that from the folks that are in this, have adopted this model. And so we have a direct primary care or DPC summit coming up in Indianapolis in July. And so if you want to learn more about DPC model, that would be a good resource. I mentioned that we're one of the co-sponsors with the National Academy of Medicine for their Action Collaborative on Clinician Wellbeing and Resilience. And I'd encourage you to look at what's just been released in April of this year, and that's their Knowledge Hub. And being one of the co-sponsors, I'm fortunate to serve on the steering committee for this effort and co-chaired actually the working group that developed the Knowledge Hub. And this is a collected resource of evidence-based and case-based sort of solutions, and goes through the causes of burnout, the effects of burnout, but then a lot of focus on solutions to try and improve clinician well-being. And so I would encourage you to check that out at nam.edu/clinician wellbeing. That's the knowledge hub there. A few more resources just to point out to you. The AMA has a great set of resources at stepsforward.org. You don't have to be an AMA member to access these. They developed these through a HRSA grant. And so, but there are about 40 some modules there, most of them focused on things that you can do to improve at the practice level. So stepsforward.org. The Institute for Healthcare Improvement, or IHI, who primarily focus on patient safety and quality improvement, have developed a framework for improving joy in work. And it really starts out with question number one there is, what matters to you? Why did you go into medicine? Why do you do what you do? And then trying to build from there on, implementing things in the practice that really highlight doing what matters most. And I think this is really important for organizations to be looking at this and investing in these changes to try and improve the well-being of their workforce. And then from an individual standpoint, Stanford Medicine WellMD is a really nice set of resources that, again, have multiple surveys that you can do to assess different aspects of well-being and satisfaction, as well as multiple resources there. So, I believe that this all boils down to having a sense of meaning and purpose in what you're doing on a day-to-day basis, and really feeling energized by what you're doing, not beat down by what you're doing. And to do that, you have to have both the ability and the resources to make a difference on a day-to-day basis for your patients. You need to feel a sense of respect from your patients, from the teams that you're part of, from your colleagues, from the system. And part of that respect is being paid appropriately, being paid well, and getting the respect that primary care deserves in our system. And then, relationships are such a big part of this. And I mentioned feeling socially isolated. And so we know that, I think especially for family physicians, those relationships with your patients, with the communities that you serve, with your own family, with your teams that you're part of, with your colleagues, and trying to find ways to really strengthen those relationships. And so your call to action is, what are you going to work on? In the 5 levels of the ecosystem, are you going to try and help improve the system reforms? Are you going to influence the organizations you're part of? Work on improving the practice inefficiencies and things that you can do to improve at the practice level? Are you going to commit to doing some things different on your own well-being behaviors and habits? And will you role model the culture of peer support, caring for each other, and helping folks not feel so isolated, and making it okay to focus on your own well-being, and not just on self-sacrifice. So with that, and I like to make this point out, we're all in this together, and the insurance companies aren't going to fix this, the government's not going to fix this, the hospital administrators aren't going to fix this, the insurance companies, the pharmaceutical companies, we can't wait for them to fix this. It's got to be us. And so we all need to be involved in this. So looking forward to answering any questions. Hopefully I left a little time for that.
Yes. Yes, thank you so much, Dr. Knight. So appreciate your time and expertise. And Caitlin's going to move all of our participants over to panelists so that they can ask you questions.
Great.
While she does that, I'm going to take the liberty of asking my own question, if you don't mind. From what you shared, it looks like the AAFP's WellBeing Planner follows a traditional PDSA cycle.
Yeah.
Does the newly approved performance improvement activity utilize the WellBeing Planner to satisfy its credit requirements?
Yeah, that's what we're trying to do. We're working to build our practice improvement activity on the resources that are in the planner. And the idea is, I give credit to the ABFM. I was at a working party, it was a a couple times a year, the organizations in family medicine get together. And so I just was having a conversation with Jim Puffer, who's the CEO of the ABFM, and I told him about what we're doing with the WellBeing Planner, and that, you know, we want folks to do something like the MBI, then implement some changes, and then repeat the MBI and see if things improve. And he said, well, you know, that's a practice improvement activity that you absolutely would get credit for in the MOC world. And so, you know, again, I give them credit that they've been very willing to look at that and support development of that. And yes, we are planning to have the WellBeing Planner as a significant component of that activity.
That's wonderful. Thank you for doing a twofold event there, that you can do something good for yourself, but also earn that valuable credit.
Yeah, absolutely.
So wonderful. Hopefully we can turn this over. We have several people that have participated. Dr. Sparks, do you have a question for Dr. Knight or Dr. Caceres?
Yes, I do have a question. I'm the president-elect of the Mass Academy, and so, of course, this is part of our strategic plan, is focus on physician well-being. And in our current strategy, we're doing it as a kind of a PS wellness, that it's the physician and the system itself that need to have wellness. So my question to you is, when will the first workshop be available for the state chapters to help us?
Yeah, the state chapter workshops. We're shooting again for 2019 on that. And what we're trying to do is, you know, we base this on, for a long time, the Academy's had the chapter lecture series, which is, you know, usually a 1-hour lecture that is put together, and then chapters can adopt that. And as we started looking at this, you know, 1 hour isn't enough for this, and so that's why we were calling it a chapter workshop series, and we would see this as a 3 to 4 hour, you know, kind of a half-day workshop, and we would take some of the best elements from the national conference that we have, and try and you know, localize that for folks to be able to bring to their own states. So I wish I had more specifics for you, but that's the concept, at least. And I didn't mention that, you know, I think we have 3 of the presentations that were done at this year's conference that will be loaded up on the portal in the next few months, and will be available for members to see some of those same presentations that were done at the conference, and they'll be eligible for CME for those as well.
Okay, great. Thank you.
Sure.
Great
Good
question.
luck with that. Yeah.
Keep them coming.
The only request I might have is, I have some of the websites that I've written down here while you talked. Is there a way for you guys at the Ohio chapter to send them out by email?
Yep. Yes. Okay. Part of our archive is we will also make sure that all of the resources that Dr. Knight mentioned will also be available. So we'll make sure that everybody who participated, along with those that are joining us later, will have access to those.
Okay, great. Thank you.
Thank you. Any other questions for Dr. Knight?
Can you hear me?
Dr. Ballister, go for it.
Yeah. How can I start even exercising? You know, it's like, any suggestions?
How can you start physical exercise?
A wellness program. It's like, you know, any suggestions? Like, I've been very sedentary. I spend too many hours completing the charts. And it's like, okay, I should exercise, but I'm not doing it. Any suggestions?
Well, so, you know, using the format that we've got in our planner, you know, I think the first step is to acknowledge that you want to make that a priority, and make a commitment to that, and be willing to revisit that commitment. And so I applaud you, first of all, on recognizing that that's important. And then I would say, you know, do something that you enjoy. So I exercise on a regular basis, which I find really helpful, but I don't like to run. And the elliptical I kind of found boring, and I try and read while I'm exercising sometimes, and that's hard to do. But what I found that I like doing, and this sounds kind of crazy, but I like playing video games. And so I have a stationary bike, and I log into my PS4, and I play video games for about 40 minutes a day. And I do that probably 5 to 7 days a week. I travel a lot, so I don't always get to do it when I'm traveling. But I've found that I feel better when I do that. And so I've just made it a priority. And but I know that's hard because there's only so many hours in the day, and you've got so many requirements at work. And so I don't mean to make it sound easy, but my point is, find something you enjoy doing and something you look forward to doing, so that exercise doesn't feel like an additional burden. And so if that's walking or whatever that ends up being for you, I was, it was really interesting at our conference. We had about 458 people at our conference. We had optional yoga sessions in the morning. And the first day we had 2 rooms set up that could accommodate about 30 people in each session. And we found out right away that 60 was not enough. We had so many people that we were having over 100 physicians a day who were coming down to do yoga. Part of it, they liked the community setting. They liked being with other family docs. But many of them, because they always asked at the beginning of each session, so how many of you are doing yoga for the first time? And there were so many people who were just trying that for the first time, but lots of people who really found it enjoyable. And so I would encourage you to try some things that you haven't even thought about doing, and find something that you enjoy doing that again doesn't feel like a burden. Hope that helps.
Great suggestions. Thank you.
Sure.
Wonderful. Well, thank you, Dr. Knight. We really appreciate you leading our session today and providing such valuable insight into the tools and resources available to clinicians for combating burnout.